Planning your hospital discharge. If you are admitted to the hospital, your healthcare team will not only provide treatments to help you feel your best, but they will also work with you to develop a plan to meet your needs after you are discharged from the hospital. Your needs at discharge may be physical, social, or financial. It is important for you and your caregivers to be involved to make the best discharge plan possible. During your stay, it is important to share your wishes, concerns, and challenges, and to ask questions about your care after discharge. The plan for your care after leaving the hospital will be based on your needs. Care will be arranged to offer you a safe, healing environment and to help prevent an unexpected return to the hospital. Members of the healthcare team that may help you prepare for discharge include doctors, nurses, social workers, and nurse case managers, also known as patient care resource managers, or a PCRM. The day you are discharged from the hospital will be based on your health and treatment plan. A PCRM will meet with you during your hospital stay to develop a discharge plan. They will talk with you and your caregivers to understand what help you may need after leaving the hospital. Helpful information to share with them may include: identify who is available to stay with you at home if needed, run errands, help you to manage bills, or take you to medical appointments. Describe problems with transportation that may make it difficult for you to get to your appointments or to pick up food or medicine. Share a copy of any advance directive documents you have completed, such as a health care power of attorney or living will. Provide information on your health insurance coverage, including how to contact your insurance company if needed. Share any financial concerns you may have about medical bills or living expenses, such as electricity, rent, or water. Describe the type of help you need with daily activities, such as fixing meals, bathing, getting dressed, or using the bathroom. At times, taking your medicines as scheduled can be difficult. Tell your healthcare team if you need more information about your medicines or how to take them, or help with paying for your medicines. Your healthcare team will teach you and your caregiver the skills needed for your care at home. For example, you or a caregiver may need to learn how to care for a catheter, or to change a dressing over a wound or incision. A home health nurse or other type of care may be set up to provide you with more help if needed. If you plan to return home after being in the hospital, you may not be able to do everything that you did before being admitted. For example, you may need help with the laundry, cleaning your home, buying groceries, or taking care of pets. In some cases, even when you are ill, you must take care of others, such as small children or elderly family members. These responsibilities should be discussed when planning your discharge. We encourage you to reach out to those who can help with caring for you at home as you recover from your hospital stay. Illness and hospitalization can lead to other problems. For example, when you return to work, you may not be able to do certain job duties. Some people need to make small changes, such as working fewer hours. Ask your healthcare team when you will be able to return to work and if there are any restrictions you need to follow. At discharge, you will go to a place to recover based on your healthcare needs. This may be your home, the home of a family member, a rehabilitation center, or a nursing home. Your healthcare team will talk with you to make sure the location is safe and that your care needs can be met. There are many things to think about when setting up your discharge plan, including what type of healthcare services you will need after discharge. How often will these services be needed, and who can provide you with these services? Do you need someone to stay with you to be safe? If so, who is available to stay with you, and how long can they stay? Will a home care worker be needed for your care? What care will they need to perform, and how often? Will you need any community services to help you after discharge? Examples may include Meals on Wheels for home food delivery, or calling a company that can provide an emergency response necklace. Is there a need for you to be cared for in a rehabilitation center or nursing home? How will you get home or to another location where you will be staying when you are discharged from the hospital? Who can take you? When are they available? And are you physically able to safely get in or out of their vehicle? Your healthcare team will help you in arranging the services you may need after discharge. They will ask if you prefer certain providers, agencies, or groups to help with your care. They will also check to see what services are covered by your health insurance plan. Although this discharge plan is worked on during your hospital stay, it will not be finalized until the time the discharge order is written. When your healthcare team decides that you no longer need to be in the hospital, a discharge order will be written. You will receive a written document that includes specific instructions for you to follow about your care. This is called an after-visit summary, or AVS. Your healthcare team will review the discharge plans discussed during your stay and confirm the plans based on your current needs. As you prepare to leave the hospital, there are important things you and your caregiver need to know. If you are going home after discharge, what type of care will you need? Do you or your caregivers know how to provide this care and how to get needed medical supplies? What is the plan for caregivers in the home? Will you receive home health visits? If so, who will be coming? When is their first visit? And how do you contact them? What follow-up medical appointments are needed? Have they been scheduled? If so, when and where are these appointments? Make sure you know how to contact these healthcare providers for questions or if there is a need to reschedule a visit. Ask about the medicines you are to take, when to take the medicine, how to get prescriptions filled, and if there are any special medicine instructions. Make sure you understand any changes to your current medicines and how to take new medicines ordered by your doctor. Make sure you understand what food or fluids you can or cannot eat or drink, any activity restrictions or exercises that are needed, if you have any special bathing instructions, and how to care for any catheters, tubes, dressings, or injections that you may have at discharge. It is also important to know which symptoms should be reported to your doctor immediately and when to call 911 for an emergency. It is the responsibility of you and your caregiver to be sure that you understand these instructions. Read over these instructions and ask questions as needed. Your healthcare team will let you know what time someone should pick you up, or if needed, they will arrange transport for you. We hope this information has helped you to understand your role in developing a plan for your discharge from the hospital. Our goal is to have you return to the safest healing environment possible. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.